My husband went to work every single day for 16 years to save lives. That's what got him up in the morning. He went to work to save lives, and then he ended up taking his own.
Triggering content warning. This episode discusses mental health and suicide. If you're struggling, please call or text 988 for support.
And I think being a doctor killed him. I'm very bold in my statement, and I know I'm being bold, but I think that if Matthew had been in a different line of work, that he would probably still be alive.
Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. Hello and welcome back, everyone. Today I have a very special guest with me, Betsy Gall. Betsy Gall is an author and advocate dedicated to raising awareness about physician suicide. Following the tragic loss of her husband, Dr. Matthew Gall, an oncologist who died by suicide on Thanksgiving Day in 2019, Betsy channeled her grief into writing The Illusion of the Perfect Profession. I have the book right here with me. This memoir combines her personal journals and letters to God, detailing her journey through faith and healing after such a profound loss. Betsy is an active real estate agent, investor, landlord, and habitual remodeler. She continues to give back to organizations like the Dr. Lorna Breen Heroes Foundation, speaking across country about physician suicide to prevent other families from experiencing similar tragedies. Welcome, Betsy, and thank you for your courage in sharing.
Thank you so much for having me. I'm happy to be here.
I am so excited to have your presence today, and I am going to jump right in because the cover of your book, along with, of course, the profound impact and the journey that you've gone through, really attracted me to want to learn more and educate myself. But I want to ask you, why did you choose this particular title, The Illusion of the Perfect Profession?
I get asked that question a lot. I actually kind of think that my idea of what a physician was and what a physician did and what the job entailed was much different than reality once I learned that after being married to a physician for 20 years. When you're a little girl and it's like, oh, you're going to marry a doctor, a lawyer, a fireman, or something like this, you just think like, oh, well, that would be perfect. And it's a very difficult job. It's a very hard job. And I feel like our doctors are under a ginormous amount of pressure and stress, yet they have to make everything look perfect on the outside. And I think the average person just doesn't know really how challenging the job is.
Yeah, I love that you drew that parallel towards, how we look at this profession from the outside. And I remember before I started my journey in medical education, my parents are both physicians, so I would look at them and I would like, okay, my mom's got the answers to all problems. My dad's got the answers to all problems. They have it all figured out. And as time went on, that sort of became kind of painful.
Mm-hmm. I can see why. That's a lot of pressure on you to have not one, but two physicians in the family. And I always remember thinking, Matt is expected to have the answers to everything. And really, he's just a human being and nobody knows everything all the time. So, yeah, I think that overall, when maybe public's perception has changed recently because we're more educated, but our doctors aren't out golfing at the country club and living in this ginormous mansions, and it's just a tough job. And I think back to our days where Matthew would tell our children not to go into medicine, which I find really sad. But he was like, there's a lot easier ways to make money. And that always kind of struck me because I know he would have been really proud to have one of our children go into medicine, but I think he just was so disillusioned, especially at the end of his life, of what that job really entailed.
There's so much that in that, what you said, that feeling of Wow, I signed up for this. Truly, it's kind of like you have this reasonable expectation of how hard it potentially is, but then you really don't know till you're there. And this always like when you put those two letters in front of your name, doctor, now everyone's looking at you for answers for pretty much everything. So, reflecting back his life and when you were as a spouse witnessing all of this happening, would you consider him a perfectionist?
Yeah, most definitely. I mean, not in every aspect of his life, but for the majority of how he lived, yes, I would say he was a perfectionist. Starting from a very young age, straight A student, captain of the football team, prom king, put a lot of pressure on himself to be the best all the time. And then I didn't know Matt when he was young growing up. I met him when he was finishing his residency. But just even in the way he dressed, everything was very, meticulous and perfect all the time. He was very organized. He definitely had his quirks and had his things. I mean, he threw his pants on the floor. I mean, it wasn't like it was always just perfect. But I think, especially when it came to cancer care with his notes, I remember him always saying that he liked to take a lot of time and he put a lot of pride into his note taking, and he was very thorough and he liked to teach patients, and there was just never enough time. He was an oncologist, and so he had to break really tough news to people, but he liked to explain what the cancer was doing in their bodies. He had a whiteboard in his office. And I think he would get frustrated because just time restraints and being told how he had to practice medicine from like the suits, as he called them, where he was a real people person and a healer at heart. Matt's identity was being a doctor. He knew he wanted to be a doctor at the age of 3. And so it was a huge part of who he was as a person. I always say he put medicine first. I mean, he was a doctor first and then a husband and a dad. But at the core of who he was a doctor. And I think being a doctor killed him. I'm very bold in my statement, and I know I'm being bold, but I think that if Matthew had been in a different line of work, that he would probably still be alive.
Can you expand on that a little bit more?
I think that medicine took every piece of him. I describe in the book, I tell our story and I'm very graphic and very honest. And after I wrote it, I was like, oh my God, what did I do? These are my journals. But I talk about a situation where one of my parents' best friends went to go see Matt and presented with some, I don't know what his symptoms were, but he had cancer and he eventually died. And because they were my parents' like best friends, of course, we were going to the funeral. And on the way to the funeral, Matthew said to me, do you think that John's wife is mad at me? It just struck me. And I was like, oh my gosh, Matthew, like he had cancer. And of course not. Like they loved you and they're talking about you to everybody and how great you were, but you can't save everybody. And it was that moment in time that I thought, this is just not like a normal job. This is not like Betsy going to sell a house or pick out wallpaper or, a paint color. This is really tough on who you are as a person. And so I think every patient death took a little piece of his heart. I really do. And most of our doctors, I mean, they're not getting into it for the money. They're getting into it to help people. And after amount, I mean, how much are they expected to give? And it's give, give, give. And from insurance companies to bloated bureaucracies to board exams. And Matt used to talk about the clicks all the time that he had to do to get through his day. I mean, I think it just gets to the point where it's like, enough, enough. And then at the end of Matt's life, depression hit him very quickly, very hard, had never, ever seen that before in him. So it was really only 3 months. But he came home one day from work and he worked all the time and he had stopped sleeping really. So I was really scared because he just wasn't sleeping. But he came home one day and said, I don't think I can be a doctor anymore. And I was like, okay. Like, first of all, you're really smart. So there's a million other things you could do. But he didn't see it like that because this was who he was. And he was highly specialized. I mean, what, 15 years of schooling after high school? I mean, his whole life. So that was just really, really tough. And I think if he had had a different job, I think that he would still be here, but that wasn't who he was. And medicine just took everything from him. Really, it did. He gave it his all and he loved being a doctor. So it was heartbreaking to watch. And I hope no other family has to go through what we have had to experience because death of a spouse is hard, but death by suicide is a whole different ballgame. And I had never known one person. I didn't even know a friend of a friend that had died by suicide. So I've really had to take a crash course in depression and suicide. And then, you know, when I get up and talk, I say to people, my husband went to work every single day for 16 years to save lives. That's what got him up in the morning. He went to work to save lives. And then he ended up taking his own. I mean, it just doesn't even make sense. It's so hard to wrap your brain around that, especially like somebody like Matt Gall. He loved life. He was larger than life. He was the life of the party. He wasn't some nerdy doctor. No offense. There are some out there, but he was not that. He was just hilarious and fun and liked rock concerts and mountain biking. And we skied a lot and went to new restaurants and had a great life. But medicine took it all.
Oh, thank you for sharing that, Betsy. I don't have words. I'm supposed to have the right words, but I mean, just honestly speaking, I don't have words. But I can see so much in your words that you shared. Like, who am I if I'm not a doctor? Like, I'm tired of being a doctor, but if I'm not a doctor, then who am I?
Right.
And that's a question that many people, when they're asked that question, I asked that question to my parents, I'm going to have a very hard time getting any answer. I struggle with that myself.
Yeah.
Like other high achieving professions, tends to self-select people that are not just yearning for excellence, but they're striving for that extra. It's just that extra layer over there and prevents us from asking for help. So as things were unfolding and when he was experiencing depression, as you witnessed his journey, do you think that there were factors in play that prevented him from seeking help and support and being okay with asking, I need help?
Oh, absolutely. First of all, Matt was a guy's guy. He was a little macho, not very politically correct all the time. And like he was taught in med school, you just don't show weakness, right? You're taught not to show any weakness. Matt was so full of shame when depression hit him. He knew depression hit him and he was so shameful and he wouldn't get help. I was urging him to get help. We had one friend that I was confiding in Minnesota, another physician friend, and he was like, Matt, you got to exercise, you got to get on an antidepressant, you got to see a psychologist, and you need to sleep. And Matt, he was just not doing any of those things. And it was super frustrating for me because one, he was just a very strong willed person, strong mentally, strong physically. He was just not going to have it. And even so much as the last Sunday before Thanksgiving, the Sunday before he died, we were at church and they had extra prayer teams up at church. And I said, let's just go. Let's just walk down that aisle and get some extra prayers. And he was having nothing to do with that. I think as a male, I think men have a much harder time admitting that they need help. And again, he was supposed to have all the answers and he couldn't fix himself. And here I was like, I didn't really understand depression. I kept waiting for Matt to snap out of it. I mean, this was a guy that got waitlisted to med school. That was probably the biggest hurdle he ever had to cross in his life. And he got in and anything he put his mind to, he did. So I think asking for help was just off the table for him. And he would say, I could lose my medical license. And I was like, what? And he said, yes, they ask questions on the medical board exams about mental health and I could lose my license. And that to me was insane. I was like, you're a physician. I just don't even understand it. And that's why I'm so grateful to people like Corey Feist and the Dr. Lorna Breen Heroes Foundation, who are actually changing the laws to get those questions off the books as they should be. Matt had depression. And if he had had cancer, people would have treated him very differently. But he had depression and it was a secret. And I wish he would have gotten help, but he wouldn't. I wish he had.
Yeah. As we look around right now, Betsy, and continue looking at the way you honor his memory and how you talk, talking about exactly what you said, exactly what you just shared in terms of like giving voice, because whenever I've spoken to families affected by physician suicide, there's so much confusion. Like, I just, I didn't know. Like, I didn't know this was going to happen. Whenever I have seen, as a physician, of course, I know people, who have died by suicide. And in the book, you say, there's a part in the book where you highlight the word committed. And I never ever use that word. And I always say, you didn't commit suicide. It's not that. Absolutely.
No, he died by suicide. And I love that you are not using that word anymore. And I think it's when we explain it to people, it makes perfect sense. I mean, we have so many rules nowadays, right? Like we can't say certain things. But this one, it really makes sense because Matt had no more control over his depression than, say, his cancer patients had over their cancer. He really didn't. It just overtook.
Yeah.
But it was funny because we were having coffee with our preacher and his daughter had died by suicide probably 20 years ago now. And he used the word committed. And I said, preach, we don't use that word anymore. And he kind of looked at me and he wrote a book, and he's probably 20 years my senior, very brilliant man. And I don't like to correct people, but I explained it to him and he said, that makes perfect sense. Yeah, she didn't commit anything. It's not a crime. It was an illness. So, yeah. But there is a lot of confusion because when a doctor dies by suicide, I mean, it kind of is like, but they're the keepers of our life. I mean, they're helping us every day. So it's just that much harder to wrap your head around. I think from the research I've done is they just get to such a dark, dark place. They just don't see a way out. And I've never been there, so I don't understand. It's hard for me to grasp it, but that will always make me really sad. Really, really sad.
Yeah. I really want to thank you for sharing that part again, bringing light to it. So as you walk in this journey, you bring this energy around you, Betsy. You are so full of joy and optimism, even as we, talk about something so devastating. What is things, items, changes, laws? I know Dr. Lorna Breen Heroes Foundation, I'm proud to be an ambassador and they're doing such wonderful work. But explaining it in a way that people that are outside of medicine and they can look in and they can understand, because you've seen this pain from so many different ways that other humans cannot even fathom. What do you think we need to change as a society to make things safer and better? Because it's not just that we're losing a physician, we're losing a loved one. A community is grieving loss. And if we have to get like objective and we have to get in like, okay, let's even just talk about money. Like we already have physician shortages. Like whenever I go and I make a case and I say that there's not just a very real moral case for caring for our clinicians, but also a very real financial case for it, right?
Absolutely.
And if that's what's going to get your attention, so maybe I need to throw that word in there because clearly some of the other words don't matter to you. Where do we need to start shifting some of these narratives? What should we do?
I really think it needs to start in med school. I really do. I mean, I think the whole system is so just convoluted and just so tough. I think that that's where the real change needs to happen. And I do think it is happening, but treating our residents, I think Matt made like $30,000 a year being a resident. I mean, working just insane hours. I mean, I think the pay structure needs to change. I don't think our doctors make enough money. And that's something that they don't like to go around talking about. And I think that we unfortunately have to have that tough conversation. I think you're exactly right. We're headed for a doctor shortage. How do we attract more doctors? Well, I mean, certainly not beating them up, making them work insane hours, working on no sleep, and then not paying them. It's ridiculous. I think when Matt came out of med school, I think I wrote in the book we had like $125,000 worth of debt. Well, now what is it? $250,000, $300,000 worth of debt. What other profession do you sacrifice so much just to be able to take care of sick people? I mean, I think the whole system needs to be revamped. And listen, we need hospital administrators, we need insurance companies, but they didn't go to med school. We need doctors who are busy and overwhelmed and don't have the time to even have lunch, let alone go out and advocate for all of these changes that really need to be made. For me, I share our story. I give up the personal aspect of being married to a physician for 20 years. And then I'm just so grateful to people like Corey Feist. I'm happy to be an ambassador as well to the Dr. Lorna Breen Heroes Foundation. And I really think that by just sharing personal stories, it's where we're really going to make a big difference because the general population, I mean, and that's part of the reason why I wrote my book. There were over 1,000 people at Matthew's funeral. And I think all of his patients that showed up, they're all like, they want answers. Like, what? I mean, Dr. Gall, like the happiest guy, the writing smiley faces and all of his notes and giving hugs. And I mean, if this could happen to Matthew Gall, I mean, it could really happen to anybody. What are we going to do? Who's going to take care of us? You know, our society values such warped things. I mean, I like going to basketball games and watching football, but I mean, they're making all this money and I think, well, what do you do when you get cancer? Like who are you going to go to? It's just the whole system just needs to be reworked and I think there's got to be a way to figure it out. But Matt did talk about the suits a lot and being really frustrated with that. I think when we were still living in Minneapolis, he got a scribe and that really helped. Everybody maybe needs a scribe. There's just so much. I just didn't realize how overwhelming the job was. And then, you guys dealing with life and death all the time. And it's just heavy. It's just a lot.
It is heavy. You're absolutely right. And we have to take a step back and it's like we're trying to just do patchwork. Let me fix a little bit here, a little bit there. We have to start, yes, medical school onwards. But I also love that you're educating. And I'm so grateful that you wrote the book because I think the perception in the general public also needs to change. There is so much that has changed. And I've been on both sides of the exam table as a patient. I had experiences in which, frankly, I was a doctor and I didn't understand a word that the doctor just told me while being a doctor. And so, I just get it. I get it that a lot of our patients are also they're frustrated. They're frustrated with the healthcare system. The problem is that the patients are not understanding that they are standing not on the other side of the exam table. They and their clinician is on the same side of the exam table. Because I just ask everybody, and Betsy, you might have noticed on my posts as well, ask the hospital system where you go and seek care. How are they taking care of their clinicians, their doctors, their advanced practice providers, their nurses? How much time are they allowing them to spend with their patients? What's the pressure there? When was the last time they were allowed to go for a break, a leave? I have missed family funerals because I had to write 20,000 emails before I could, just so I could go and see somebody in my family who had passed. And so the things that are expected of you. So all I ask and invite, because I think that not the general public has a right to know, because at the end of the day, they are the consumer. They have a right to know what is being done to the people that are caring for them. And so if you should absolutely go and ask your hospital system, how are you actually taking care of the employees that are then providing care to us?
I love that analogy of being on the same side of the table. I think that's great.
Absolutely.
And it's education, right? We just need, they don't, the general public doesn't see it like that, right? It's you're the doctor, you're part of this whole system,
Yeah.
and they're not able to differentiate, maybe just because they don't know.
Yeah. Yeah. And it's not, again, it's absolutely, you're right. It's not coming from a space of any ill will. I was sitting next to my husband's friend who was mad at his doctor for not responding to his My Chart message fast enough. And
Yeah.
he's like, he's angry. He's got a question. You know how it is in dinner table conversation. He just shares with me, I am your friend. I will commiserate with you, but also educate you on the same note. So I told him the doctor's schedule. And it was wild for him to realize that at the end of the day that they had 15 minutes to spend with him, that they were not making that much money, and that they were not getting all the things that was the perception. Same way, you'll also hear people get angry that, oh, my doctor stopped accepting my insurance. Well, if they're part of a larger organization, I don't know what insurances I'm taking. That's the job of somebody else.
Exactly. Yeah. And it's simply that they don't know. Attracting the best and the brightest to go into a field that pays them. I mean, that's how most jobs work. You get into a field and you get better as time goes on and you make more money. I know it's hard for people to talk about because
Yeah.
they're compensated with other people. They don't realize it's all different. Every specialty is different.
Sure.
Every region is different. But yeah, they're not making enough money. They're just not, especially when you're coming out of med school with $300,000 worth of debt or something like that.
Yeah.
So that's awesome that you were able to educate and explain. I know Matt used to get really frustrated with the time constraints. I mean, you're with this person on the worst day of their life, potentially, right? You break
Yes.
news that you have cancer and, oh, got to go on to the next one, and then people are mad if you're late and
Yeah.
or if somebody else is late. It's just this
Mhm.
domino effect. And there's just not a lot of grace. And I think, why aren't we applauding the people that are doing a great job? I feel like Matt always loved getting thank you notes from patients and cards. And I'll never forget, like when I was pregnant, he would come home with like a baby sweaters and knit blankets that his patients had given him. And I just thought, wow, this is like so sweet and so special. But the bond he had was with his I mean, I'd never thought to give my doctor a baby blanket or something like that. Now I do. Now I think about that. But just that bond that you have when you're going through such a tough, tough time and just thanking our doctors. Like when I ask doctors what they want, that's it. They want to be recognized and thanked. And how simple is that? We can all do that, right?
Absolutely. Absolutely. I was the other day, I found a box of thank you cards from when I was practicing primary care. And I just sat down. It brought back so many memories. There were lots of tears of gratitude. And I still remember on the worst of my days, really the dark ones, getting a thank you card from a patient made all the difference. And you're right. If you ask me, that's what I would say. Please give me 15 more minutes with my patients. And for my patients, if you could just, a thank you card would be great. Or a thank you, just a verbal thank you, like
Yeah.
anything. Like you use the word grace very beautifully.
Yeah. And instead, we get these surveys sent to us all the time, and you're expected to fill it out, and only the angry people fill it out. And it makes me mad. It's just wrong. It's just wrong. And the doctor's not always to blame if they're running behind. So I don't know. The system's very broken.
I think our conversation, if not any, is allowing us to examine the complexities. I think the surveys, like you've mentioned, there's one more thing with the surveys. I think we do ourselves a disservice when the way we rate a car tire change or oil change, and those are, I mean, I absolutely I'm very appreciative for the hard work that everyone does there. You can't compare, but you also can't compare complex medical decision making to that. And so when we value both things on a similar level, it's like we're doing a disservice to our humanity.
100% agree. I could not agree more.
Yeah. So thank you so much, Betsy, for sharing about that. As you look around you and you continue to spread your light and joy, what message or advice would you convey to other families who have experienced a similar loss?
Hmm. The message I would say is you will get through it. It's never gone, but you learn to live with it. I tell people all the time that you need to get help, professional help. We were really fortunate to get a lot of therapy. COVID hit just months, after Matt died. And that was just awful because I thought the Zoom stuff was really hard for the level of care that we needed. I would suggest getting in for me, and I still am involved in a widows group specifically for survivors of like husbands who have died by suicide. You need people that have been there to help you through it. I just remember just wanting to know that I would be happy again, just praying to God that somehow, somewhere, sometime I would once again find love, joy, happiness, and peace. And I would write it every day. That's just what I want. So finding the outlets that work for you. For me, it was prayer. My faith comes first. I exercise a lot. I do a lot of yoga. I practice self care. I take pretty good care of myself. That's really important. Talking to friends is important. Talking to a therapist is important. But just never giving up hope on your darkest days because it's such a heavy topic and it's so overwhelming, especially for those of us that, I just moved to a new town and have 3 teenagers to raise. But by the grace of God and just my faith, I realize that everybody has something. We're all on this planet Earth and we're all suffering. We will suffer at some point. We'll all experience loss. And to be honest with you, we're all terminal. So we're all going to die. And how do you want your life? What do you want it to look like? How do you want to live? And so that's what I really focused on was what do I want to manifest in my life to be happy again? And how can I make that happen? And if you really believe, it will happen. And we can just be grateful or we can be bitter. And it's your choice of how you want to look at the world. And so for me, I just concentrated on the goodness. Some days it was blue sky and green grass, and that was all that I could be grateful for. But there's always something that you can be grateful for. And I think gratitude has changed my life. And it just takes the sting out of feeling sorry for yourself. It's easy for us all to feel sorry for ourselves. And not that you shouldn't every once in a while. That's okay too. Crying is okay. Having a bad day is okay. But you can't live in the past and you can't get stuck there. We can all learn from it. And I hope that by me sharing my story, people learn what, it's like to be married to a physician and not just the glossy Instagram, like pretty perfect everything, because that's just not real life. That's just not.
Thank you so much for sharing that beautiful advice for all of us and for your courage in sharing your story. I encourage everyone to read Betsy's book. It is beautifully written, and educate yourself on the topic of healthcare worker suicide, physician suicide, and please support the Dr. Lorna Breen Harris Foundation. Thank you so much again for your time today, Betsy.
Thank you for having me.
This episode is part of a special series and my budding book project on unmasking perfectionism. Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.